Why do I think healthcare should be free? I think it's a necessity nowadays to be provided with the necessary resources to keep yourself healthy. For one thing, when everyone's sick, the only people that are getting anything from that are insurance companies and pharmaceutical companies because they're making money off of you dying. If people are healthy, though, they have a better chance of going to work and actually completing something useful for the world. And that's not really the biggest case. One of the bigger things is, do you really honestly want to see one of your friends or family die because they didn't have access to healthcare? And while we're saying this thing where like all these people are insured, at the same time we're sending out monthly bills over and over and over again to these people, which further taxes our whole entire system because we're sending out paper, which, depletes the trees, destroys the environment, all that nonsense that we shouldn't be doing. But a bigger thing is causing unneeded stress on everybody. Like in my circumstances, I collapsed a lung when I was like 18 or 19. Now I owe like over $20,000 over that. I don't have $20,000, and it has caused me a tremendous amount of stress. And it's ridiculous that I should have to owe that much for something that was just pure coincidental. It's not like I don't want to help the world do things. I'm sorry that I wasn't specifically educated at the time and I didn't know how to handle the situation correctly to get the costs down lower. But at the same time, it'd be nice to just be able to go and have your condition treated and be able to go back to your day and go back to work. But besides that, we need preemptive care to live longer. I mean, doesn't that make sense to people? Do you really think it's necessary to be charging these people an arm and a leg? And everyone goes on because a lot of people don't want it. A lot of people in the medical field because they're afraid to be paid less money. They're not going to be. We can make it so they're not paid less, so they don't have to live below their means for going to school and doing all the stuff that they did. Even though, let's face it, a lot of people nowadays in medical school, there's the few that just stay in class, study all the time, they go through these hard internships and everything like that. But a lot of them have fun doing it, and a lot of them, let's face it, drink all the fucking time and party like motherfuckers because they're in college. They're going and they're having a good time. I mean, I understand that they went to school, and I get this. But a lot of these people were given better opportunities than other people. And it's just creating another class system that just doesn't work the way that it should. I mean, I get it. People should have good houses. People should have all these nice things if they're willing to put in work. And that makes perfect sense. And I completely understand that. But we need to take care of all these other people too. Just like how the Netherlands is now taking care of their junkies. And guess what? Now that they're taking care of them and giving them free heroin, which sounds stupid to a lot of people, it wasn't stupid because now they have less junkies. They have less people actually doing it than other countries. But that's getting off topic. But the big thing is because it's still controlled by money, corporations, lobbyists, people in our government, crooked politicians, they're taking advantage of the system. Just like this guy, I can't remember his name, who jacked up the price of the AIDS medication. And they're just like, oh, well, I'm going to jack it up a couple 100%, 1,000%, and even though all these people are suffering, I'm gonna make bank doing it, and it's not that big of a deal, and I'm gonna come off with a smirky ass attitude, little smile, even though I did something that was really fucked up. And this stuff goes on all the fucking time, except people are sneakier about it, and people don't realize it. It's just like these modern inventions that could save millions of lives that are just suppressed, and we're just like, oh yeah, well, the FDA's got to go through it, and you'll see it in like 20 years, even though you're dying of cancer right now. Thanks, guys. I mean, seriously, the whole system is corrupt. All the regulatory bodies have been have had people just coming in and corrupting them. They're controlling parts of the world, and they're controlling the healthcare, and they're making it so healthcare is more expensive, and that they're going to make money off of you dying. And that's not right. That's not what healthcare is supposed to be about. Healthcare is supposed to be about helping people. Helping people live longer, helping people live better lives, helping people be able to work longer, spend more time with their family, spend more time with their friends. See, like, if I want to go to a doctor, I shouldn't have to be completely worried about not being able to pay rent or pay for gas. I could have a problem. I should be able to walk in, do the daily checkup, 6 months. That's the checkup. That's when you're supposed to have your checkups, every 6 months. I should be able to go in, get it done, be out in an hour or two, and if nothing's found, I shouldn't have to deal with it any longer than that. It should be done. I mean, yeah, these people need to be paid, and I completely understand that. I completely agree with that. I mean, I don't agree with capitalism, the way it's set up, but I agree that people need to be rewarded for their efforts in helping people. But I'll come back to this. That's one of the reasons I think healthcare should be free.